Yeah. The coat hanger is an oft-portrayed symbol of abortion before Roe versus Wade. Just over 48 years ago, women, when faced with a life-changing event, were forced into back-alley abortions and other unsafe procedures. Many women, out of desperation, used a coat hanger to attempt to end the pregnancy themselves. Unfortunately, this led to many lost lives. Thankfully, Roe versus Wade passed in 1973, and women were given the option to access a simple, safe, and effective procedure to end a pregnancy. However, today, those rights to such a simple healthcare procedure are once again under attack. Legislation restricting access to abortion in the U.S. has risen in an unprecedented amount in recent years. Unfortunately, such legislation does little to reduce abortion rates, and instead puts women once again at risk of unsafe and life-threatening procedures. Instead of wasting efforts restricting access to healthcare procedures, we should instead be focusing on measures that actually reduce the abortion rate, such as access to contraceptives and providing comprehensive sex education. Access to abortion is dwindling as more and more restrictive legislation is being written and passed into law. In fact, more laws restricting abortion have been passed in the past 3 years than in the entire previous decade, reports Laura Bassett of the Huffington Post. According to a recent study done by the Guttmacher Institute, from 2011 to 2013, a total of 205 abortion restrictions were enacted in the U.S., and the onslaught of new laws is already taking a toll on abortion clinics in order to keep their doors open. As of August, at least 54 clinics across the country were forced to close their doors or stop providing the procedure since 2010. Unfortunately, this doesn't just affect women seeking abortions, it also affects women seeking simple healthcare procedures such as breast cancer screenings. It closes affordable clinics that women need in order to access these important procedures. And not only does the increasing amount of legislation infringe on our right won by Roe versus Wade to make these healthcare decisions, it also just does little to reduce the abortion rate. Restricting access to abortion does not decrease the amount of abortions happening. Instead, it increases the risk of unsafe procedure, putting millions of women at risk. New York Times reporter Elizabeth Rosenhall notes that a collaboration between the World Health Organization and the Guttmacher Institute showed that a global study of abortion has concluded that abortion rates are similar in countries where it is legal and countries where it is not. And that suggests that outlining the procedure does little to deter women from seeking it. Moreover, the researchers found that abortion was safe in countries where it was legal, but dangerous in countries where it was illegal but performed anyways. In fact, limited access to abortion services could actually increase the amount of abortions performed. Maria Chang of United Kingdom news site Independent reports that abortion rates are higher in some countries where the procedure is illegal, and that about 47,000 women died from unsafe abortions in 2008, and another 8.5 million women suffered serious medical complications. So, if restricting abortion doesn't reduce the abortion rate, what will? Abortion is reduced by comprehensive, medically accurate sex education and the availability of contraceptives. Catherine Courage of the Scientific American reports that a study by the peer-reviewed journal Obstetrics and Gynecology indicates that access to free contraceptives has the potential to cut the abortion rate by more than half. Comprehensive and medically accurate sex education, not just the abstinence-only education that is currently in most of our nation's schools, is also key to lowering the abortion rate. Comprehensive sex ed drastically lowers the teen pregnancy rate, which in turn decreases the amount of abortions such teens would be seeking. According to a report done by the California Department of Public Health, California's teen birth rate has dropped by 60% thanks to measures such as expanded sex education efforts. As you can see, this healthcare procedure is currently being over-legislated in attempts to reduce the abortion rate, but instead it is putting millions of lives at risk instead of reducing the abortion rate. Access to abortion in America is under threat. Instead of attacking these healthcare procedures, we should be working towards a comprehensive sex education and making sure that every woman has access to birth control. Let's not bring us back to a time where women turn to coat hangers and back alley abortions. Abortion is a safe and simple procedure that should be a private healthcare decision available to every woman. So, next time you turn on the TV or the radio and hear someone railing against abortion, remember that access to this healthcare procedure is important to women across the United States, and that there are much better ways to handle this issue.